Good afternoon. My name's Riley Normandin, and I'm the Director of Global Business Development for AMD Global Telemedicine. Now, for the next 10 to 15 minutes, what I'm going to do is I'm going to talk about who we are and give you a background on AMD, what we do, so to show you the technology and how AMD takes a different, unique approach to telemedicine and some of the things we do differently than others in the industry, and also give you some examples and use cases of some global success stories that we've had. And finally, I'm going to follow that up with a demonstration of our technology in the core of the AMD solution, which is our Agnes Connect platform, which allows the medical device data to easily and reliably and securely be delivered to the provider in the highest possible quality. So, who is AMD? Now, AMD has been around since 1991. We are not a fly-by-night COVID solution. So we have been around from the beginning. So we have deployments in over 100 countries, over 10,000 customer endpoints, and we comply with all universal global regulations and standards. We have clients ranging from small, rural, single clinics in the mountains of Bhutan to enterprise-wide healthcare systems and countrywide deployments as well. A quick kind of bird's eye view of some of our deployments around the world. And just a quick look at some of the benefits of telemedicine in the current world that we're living in. So COVID-19 has obviously brought telemedicine to the forefront, and a lot of those benefits are obvious. But a lot of the long-term benefits that you can now, telemedicine, the adoption allows you to reduce isolation during COVID-19, during and after, in making best use of limited resources, right? So many of the providers and specialists, if they are sick, or you can benefit from other providers outside your network in other parts of the country or other parts of the world. You can manage chronically ill patients, lost access to healthcare during the pandemic. You have quicker access to specialty services and load balancing physicians' time and expertise, increasing the coverage area. What we do, and this is an important slide. So there are telemedicine programs and solutions that have popped up all over during the past 6 to 9 months during the pandemic, and a lot of that is direct to consumer and providing care from the patient's phone, and that is an important piece and a very useful piece of telemedicine and telehealth. And AMD does do that. However, our specialty and what we do better than anyone else is we provide the device aggregation to allow telemedicine consults to happen just like an in-person consultation would take place, where you have the medical tools on the side of the patient and the nurse, and allowing that provider or specialist to examine that patient with those tools. The only difference is you can't physically reach out and touch that patient. And we do that through our Agnes Connect platform. So Agnes is unique to anything else in the industry, and we recognize and acknowledge that video conferencing is an important piece of telemedicine. Right, having a high quality face-to-face communication between the patient side and the provider is extremely important to give them a good experience, give the patients a good experience, give the providers a good experience. But the most important part in making a diagnosis from the provider side is the medical tools that are available to them. So listening to that patient's heart and lung sounds, seeing those live vital signs, being able to look inside the patient's ear or see a live EKG using an ultrasound, any type of medical examination that should be able to happen in person can also happen through Agnes. And we do that by focusing on the encounter itself. And as far as the data is concerned, we hold that data until the consultation is completed, and then we send it to their existing electronic health record. So some of what this allows you to do is you can implement enterprise-wide telemedicine programs. Everything from carrying a portable case into a patient's home, putting it in the back of an ambulance, or having a having a mobile cart inside a long-term care facility, being able to move that bedside to bedside. Agnes is very adaptable and flexible in how it can be used and deployed. The only difference is which devices are at that station or unit to examine the patient. So some of the Agnes differentiators, and there are many. One, and I had mentioned previous, is our medical device interoperability is unmatched in the industry. So many other products are strictly audio and visual, where we have over 40 different medical devices and growing that already have the AMD stamp of approval. And we also take the approach where if you already have an investment in, say, a video otoscope or a digital ECG, there's no need to reinvest in a device that can do the same thing. You can use many of your own devices. So we are medical device agnostic to a degree, and allowing you to maintain any investments you've already made. We also, and this is an equally important one, is there's no provider fees. So what that means is you have the ability as an organization or a health system to allow all of the providers in your network in the country or in the world to participate in your telemedicine program at zero cost to those providers. The only cost is at the clinic side, where, say, the mobile cart or the portable case is. You can have as many providers connect and provide services as you'd like. Now, some customer success stories. Many of the challenges globally are the same, and many are unique. Say the ones I'm going to share with you over the next couple of slides, a large percentage of that population live in rural areas. So they have limited or no access to primary care or specialty care. So, and there is a feeling of isolation for those citizens or those patients, where they aren't given the same opportunities or access to the same quality physicians because of where they live. Telemedicine can, of course, even that playing field and allow those patients to have access to that same quality physician that's living in the capital city, even though they're living in a small rural town that otherwise would take them, 12, 18 hours to get to. So it allows you to, again, level the playing field and provide equal access to healthcare for everyone in the country. And limiting travel is a big one too. A lot of the countries and the health systems we work with, they say some of the specialists that they have will spend one day traveling to this location, the next day traveling to another, and so on and so forth. And telemedicine allows those physicians to provide care to all 5, 6, 7 different facilities or locations from the comfort of his or her own home. So they're cutting down on that travel, and they're improving their quality of life because they're not spending half their day traveling in the car. Quickly, the program we did in Bolivia, where uh, we deployed 339 locations, and their focus or their goal was to improve the pediatric and women's health, as well as primary care, to all 339 locations. And they have done that by they've increased access. So having first level care for pregnant women early on in their pregnancy, where they're doing a lot of preventative care to increase access and hopefully improve their infant mortality rates, among other things. And those carts in Bolivia are equipped with nearly every medical specialty: otoscopes, vital signs monitors, ECGs, spirometers, things to cover many specialties because of how rural some of these locations are and the difficulty it would be for a specialist to travel to them or for them to travel to a specialist. Greenland is another interesting use case where the island itself is a third the size of the United States with a population of about 56,000 people. And many years ago, when we first started speaking with them, they were spending about, on average, about 20 million US dollars a year in medivacs, traveling and transporting their patients and citizens in remote areas to the capital of Nuuk or to Denmark, because there was no real way to triage those patients. So if they were having chest pain, they would have to send a helicopter or another way to transport them, and those costs add up very quickly. So by implementing telemedicine in every village with a population of 50 or more people, they're able to cut that cost in half within the first 18 months, just by being able to cut out those unnecessary transports. And um, similar to Bolivia, they had some geographical challenges and network challenges where they connecting to satellite, whereas some clinics had excellent bandwidth or network. Our solutions are very adaptable so that they're not bandwidth heavy. You can do store and forward, or you can do live encounters. You can do a hybrid of both. So you can adapt to whatever network or internet situation you have in your environment. Um, Finally, in excuse me, in Estonia, where this was a much smaller scale project, but they had one dermatologist serving the southern region of the country, spending one traveling to one clinic on Monday, another on Tuesday, and another on Wednesday. So if you wanted to see this dermatologist um, and it was Tuesday, you better make sure that you get to him. Otherwise, you're going to have to wait another week. So they they implemented telemedicine at these 5 clinics. Now that dermatologist does not leave his or her home unless it's a particularly important meeting or urgent consultation, and they can provide care to all 5 facilities 5 days a week. And just to show you our end-to-end solution. So I mentioned Agnes. Typically, what we do to configure the system that's most appropriate for the program is first determine the medical devices that are required to treat the medical specialties that you want to serve, and then how do you want to deploy it? Is it being carried into a patient's home? Is it going to be static in a building, or does it need to be on a mobile cart being moved from one room to another or one bedside to another in a facility or hospital? So all of these, the hardware, they all work the same. Could also just be a desktop PC or a laptop. They all work the same. It's just a matter of how it's being used. It's no different than a having an off-road vehicle versus a motorcycle or a sedan. They'll all get you from location A to location B. It's just how you need to get there. Some examples. So now, um, My contact information is right here before we get into the demo. Um, Thank you for your time. Please feel free to reach out to me directly. Again, you see my contact information here. Again, I'm the director of international business development at AMD, and I very much appreciate your time. So from here, I'm going to start the demonstration, and hope to hear from you. Thank you.
Okay, so what Ron and I are going to do right here is we're going to simulate a telemedicine encounter being used as a screening tool for COVID-19 patients or patients that are presumed to have COVID-19 symptoms. So in this scenario, what you're viewing is the doctor side. Now, Dr. Ron is going to be playing the role of the doctor, who's remote or perhaps even on the other side of a wall inside of a clinic. I myself am playing the role of the patient, and I have a mannequin here playing the role of the nurse in this scenario. So when Dr. Ron logs into his landing page, he sees a couple of things. He can see the health systems that he's authorized to provide care for, in which we see AMD and AMD demo clinics. So in that scenario, that could be perhaps a different region of the country, two different health systems altogether. So Ron is going to click on AMD demo clinics, and it shows him that there's two clinics that he is authorized to provide care for. Agnes Clinic 2, you can see, is offline. Agnes Clinic 1 has an in-session indicator, which tells him that it's online and they're logged in and waiting for him. So here, he's going to click Start Session. And now, Dr. Ron is inside the session, and we're going to start role-playing this scenario.
All right, so the first thing that I will do is, before I actually join the patient, I would look for the intake form that would actually help me to better understand what Riley, is being seen for today. And as you can see, I have a coronavirus interim person screening form. So I'm going to be looking for temperature. I'm going to be looking for, is he short of breath? I'm going to be looking for, does he have a dry cough? Has he been exposed to anyone? And then I'm also going to ask him some of those same questions. So the very first thing I do is I look at the actual documentation, and I can save that. The next thing is, on the far side, Riley's vital signs have already been taken. And as you say, Riley is with the nurse. So I look at this. He has a low-grade fever, which is definitely, I'd be looking at his blood pressure, SpO2s. And we could also have them, if they wanted to, we could add something in here to put in respiratory rate, just in case he's short, if he's short of breath as far as respirations go. So I have the baseline information. Now that I have that, the next thing I'm going to do is I'm actually going to launch a call to Riley and to the patient on the other side. All right. So how you doing today, Riley?
Hi, Dr. Ron. Feeling a bit under the weather. Haven't felt great for a few days. So thanks for taking the time to see me and check me out.
No, I appreciate that. So the first thing you notice is that I'm able to control the camera on Riley's side. So if I wanted to see if he was short of breath to the point where he was having trouble walking, or if he had like a tripod posture going where he's so short of breath if he's standing. But for the purposes of this, we'll continue with the actual demonstration. So Riley, I understand that you have some signs and symptoms here. I saw that you have a fever. How long have you had your fever?
It's been progressing now for 5 or 6 days, but I would say it's been getting worse over the past 5 or 6 days.
Okay. Do you feel short of breath, or?
I do. I've been wheezing a lot and coughing quite a bit too.
Okay. Is it a dry cough, or is it a productive cough? I saw that it was dry in your notes, but I just want to get your take on it.
I would say it's a dry cough. It's it started off as relatively mild, but now it's pretty severe.
Okay.
Yeah.
When you're walking, do you get short of breath?
Yes.
You do. Okay. Does anyone else in your family have any of the same signs and symptoms, or any of your friends that you've been around?
Not that I know of.
Not that you know of. Okay. And of course, the obvious question with everything going on in the world right now, and that we're all aware of, have you, that you know of, been exposed to anybody who's had the COVID-19 virus, or that's traveled to certain countries like Italy, China, Spain, any countries such as that?
Not that I know of, but about a week ago, I went to see a movie and there was the theater was packed, but I don't know for sure. That's the last
Okay.
time I was in a group.
Okay, well, I've looked at your intake form. I appreciate you working with the nurse over there to take the time to do that. And your vital signs, you do have a little bit of a fever and you do have a dry cough. So let's just do a physical assessment on you real quick here. Okay, so first thing I want to do is I just want to listen to your heart and lung sounds if I can, and the nurse is going to help you on the other side. So what I'm going to do is I'm just going to go over here on my side and I'm going to turn on an electronic stethoscope. Now I can control everything from here. And of course, what would happen in a real life situation is the mannequin to the left of, or to Riley's right would actually be, let's listen to your heart sounds first, if you don't mind. Got the Bell stethoscope. Okay, I'm going to turn up the volume. And we're doing this through a screen sharing app to be able to capture both sides of this. So you're not going to hear it, but let me take a listen here to your heart. Okay, that's good. Now the nurse is going to, more importantly, I really want to get a good listen to your lungs. Okay. You say it's a dry cough. Is there any production at all, Riley? Like, do you have any sputum coming up or any of that, or no, or is it just completely dry?
No, it's been mostly dry.
Okay. All right. Let's go ahead and the nurse is going to help out here. Let's just go on your back, and I wanted to put it, she's going to put the stuff on your left lower lobe, and I'm just going to listen to it. And if I want to, I can record it, but for this purposes, I'm not going to. I just want you to take a deep breath for me, please. Deep breath. The deep breath. Okay, let's go in your left front lobe down here. Have the nurse put it in your left front lobe. And of course, I would have these numbered for the nurse on this side. There you go. Put it in your front, please, like down here on your lower left, just right in there. Okay, that's good. Just breathe normal. Okay, now I want you to move it up. Just move it up right up here. Just want to get over your bronchial, your airways up there and see if you have any kind of a wheeze or anything going on. Just right up in there. That's fine, nurse. That's good right there. That's great. Okay, deep breath, please. Now, when you do that, Riley, do you feel like you want to cough?
Yes.
Spasm or anything in there? Okay, all right, that's good. Okay, I got a good listen to your lungs. You're good there. Okay. Next thing I want to do is I just want to check out your, which is important on this. I do want to check out your breathing functioning. Okay, and if on the other side there, what you're going to see is the nurse is going to be with you, and the nurse is with you, and what you have is something called a spirometer, okay, for spirometry. And what this does, it allows me from a distance, and I'm just going to go to documents up here, it actually allows me to be able to evaluate your lung functioning abilities, okay? So I'm just going to stop for a second. I'll let the nurse explain to you and walk through how you are going to perform that test on your side. So of course the nurse would work with Riley. He's going to actually do the test. He has a spirometer, and I'll let you explain, Riley, how this works.
Okay. So as with many digital spirometers at this point, the digital spirometer right here is launched, and there are incentive-based program for the patients to make it easy. So in this case, it's a tree with leaves on it that the patient blows into until all the leaves are off the tree, and then that test result will be pushed directly to Dr. Ron. So when I blow into it,
All right, wonderful. Okay, great. And basically it runs that strip. I have it on my side, and then I can look at Riley's function. I would download this and I would look at the specifics of it, but I can see right here.
and we'll throw this out for sanitary reasons.
Okay, so as I look at this, of course I'd expand it. We're not going to take the time for the demo, but you get how the information can come through. Okay, all right, this is all great. So just a couple of things. So first of all, I want to thank you for coming in today. It's important. I know you live in a rural area where we're not seeing as much of the COVID-19, but it's important that we get in so we can stop the stem of this. So a few things. Your spirometry did show a little bit of below normal lung functioning for what I would expect for someone your age. So that's a little bit of a concern. You do have a low-grade fever. It's not high, low grade. I saw in your intake form that you had some, it said that you had some aches and pains.
And I have a sore throat too.
You do have a little bit of a sore throat?
Could you take a look at that?
I would love to take a look at your throat. Yes, yes, let's do that. Let's take a look at your throat. There we go. Okay, the nurse is going to help you with that. So the nurse, of course, would be the hands of Riley. Okay. Perfect. I got a good snapshot of it. Okay, do it again, please. Let's do me the Okay, wonderful. Okay, I don't see any real redness back there or anything. Is it further down, Riley, or is it up in the upper part of your throat?
It's in the upper part of my throat.
Okay. Do you have any kind of an earache or anything like that?
I do have an earache actually.
Okay, while we got this, I'm just gonna ask the nurse to put the otoscope on. I just want to take a quick look in your ear as well. I just want to make sure that what we're dealing with here isn't just a throat kind of a ear infection type thing that's coming on, which is that time of year. So, okay, just gonna put it in your ear. Just hold it still. All right, that looks beautiful. I'm gonna snapshot that. Okay. Move the eardrum. Yeah, you're good. That's wonderful. Okay. You can take it out slow. Beautiful. Okay. So your throat and your ear actually looks quite good. So based on what I saw, Riley, a couple things. So first of all, like I say, your respiratory function was a little bit below where we'd like it. And but the good thing is I didn't see anything in your throat, didn't see anything in your ears. You have a temperature. You do have aches. But I think just to be safe, because you really do have kind of the two hallmark things we're looking for here to be concerned. You do have a fever, and you also have a dry cough, a little bit of respiratory, I don't want to say distress, but a little respiratory dysfunction that it's worth having you tested for the COVID-19 virus. So I'm going to order that and do it in locally in your area, and then we'll take next steps from there. We'll notify you as soon as we get the results. And in the meantime, though, I just ask, please be very, very cautious. Practice social distancing. Keep at least 6 feet away from people. Don't be touching people unnecessarily, even your family members. Keep 6 feet. And I know you have a dry cough. Just really protect and keep yourself covered, so you're not, if there is a virus, you're not putting it out there. But the good news is you're a young man. You're in good health, and let's just go from there and find out what we're dealing with, and we can move forward. So do you have any questions for me?
No, I don't think so. I don't think so. Will the information or any of these notes be made available in my my medical record?
They will. And okay, and there's where we'll stop the role play. So thank you, Riley. So what you saw here was we're just showing you the diagnostic capabilities and the interaction that you can have over telemedicine to really have as close to that lifelike diagnostic assessment of a patient from a distance as if you were in the same room. So when you look at COVID-19, listen to heart and lung sounds, looking in the throat to see if the throat's there, looking in the ear, of course, temperature, spirometry for lung function, all of these other things that are very, very important that you would do as if the patient was in the room with you. The other thing that we did is, if you notice, is everything that Riley and I did during this test, the spirometries here, the scopes, we can take different pictures of his throat, and I actually did not hit the button for his ear. I should have, but basically we have the intake forms. So everything that happens during the actual consult itself, we saved it, and we actually have that information, all right? So now there's a couple things we can do. One is we can hit select all. I want to keep all of these documents, and I could have even stored his heart and lung sounds in here as well. And what you'll see here is what I've actually done is I select the documents that we can select the documents that we want to keep. We can save these. We can save these to the EMR, and this would require work on the front end where we have the patient ID number. And of course, the images would go where the images are supposed to go. The spirometry would go where the spirometry is supposed to go into the actual electronic health record. And the intake forms will go there. The other thing we can do is we can simply just basically take all of this, and we can just export everything to a PDF document, right? And by doing that, we have a report, and what it does, it just takes everything from the consult and it puts it into one nice, easy, simple to use and follow document on this side, so you can see the spirometry and all the other things that go with it. So it's a really easy, nice way to consolidate and not have to do a bunch of integration to electronic medical record. So just want to thank you for your time. And as I say, the proof here and what this is about is showing the diagnostic capabilities for the COVID-19 virus and what you can do with telemedicine to provide care from a distance, to provide diagnostic assessment. And then after that, of course, we could provide treatment once there is a positive diagnosis that's made. Thank you.